There are campaigns to remind women to do their breast self-exams monthly, but did you know that men should also be doing a monthly self-exam? Welcome to the Inspired Vitality Show. I'm Catherine, and in this video, I'm talking about Testicular Cancer Awareness Month, which is designed to bring awareness of testicular cancer and promote self-exams. I'm going to run through the facts and the risk factors and the symptoms, but also give you an important resource at the end. So stick with me, you're going to love it. First, tell me, are you a man between the ages of 15 and 39? Or do you have a man in your life that falls in that age group? Let me know in the comments. Regardless if you are a man or a woman watching this video, this information can help save lives. Now, compared with other types of cancer, testicular cancer is rare. However, it is the most common cancer in American males between the ages of 15 to 39, particularly between the ages from 30 to 39. About 1 out of 250 men and boys will be diagnosed with the disease in their lifetime. Testicular cancer is highly treatable, even when the cancer has spread beyond the testicle. Testicular cancer occurs, of course, in the testicles or testes, which produce the male sex hormones and sperm for reproduction. The cause of testicular cancer is not known. However, there are several risk factors. I've already mentioned age. More than half of the people who are diagnosed with testicular cancer are between the ages of 20 to 45. It's a little bit different than what I mentioned before, but it can vary. The second risk factor is an undescended testicle. This means that one or both testicles did not move down into the scrotum before birth. This condition increases the risk of developing testicular cancer because it is often fixed at a young age. Many people don't know that they've had this condition. The next risk factor is family history. A person who has a close relative, particularly a sibling, who has had testicular cancer has an increased risk of developing this disease. Then there's personal history. People who have had cancer in one testicle have an increased risk of developing cancer in the other testicle. It's estimated that out of every 100 people with testicular cancer, 2 will develop it in the other one. Although people of any race can develop testicular cancer, white people are more likely than those of other races to be diagnosed with testicular cancer. And lastly, HIV. People with HIV or AIDS caused by HIV have a slightly higher risk of developing one of the types of testicular cancer. When I was diagnosed with breast cancer, I was uncomfortable talking about it because it felt personal. So if you're a man watching this video and feeling a little bit uncomfortable with all of this information, I get it. But I am willing to risk being uncomfortable to help save lives. Are you? Share this video with the young men in your life. Pain, swelling, or lumps in your testicle or groin area may be a sign or symptom of testicular cancer or another medical condition requiring treatment. The signs and symptoms of testicular cancer can include a lump or enlargement in either testicle. If found early, a testicular tumor may be about the size of a pea or a marble, but it can grow much larger. There might be a feeling of heaviness in the scrotum or in how the testicle feels. For example, a testicle may become firmer than the other one. There might be a dull ache in the abdomen or groin. There might be a sudden collection of fluid in the scrotum. There could be pain or discomfort in a testicle or scrotum with or without swelling. There could be enlargement or tenderness of breasts. Although rare, some testicular tumors make hormones that cause breast tenderness or growth of breast tissue, and there could be back pain. Cancer usually affects only one testicle, so be sure to see your doctor if you detect any pain, swelling, or lumps in your testicles or groin area, especially if these signs and symptoms last longer than 2 weeks. Many symptoms and signs of testicular cancer are similar to those caused by non-cancerous conditions. These signs and conditions include a change in size or a lump in the testicle, which could be a cyst, it could be enlargement of blood vessels, it could be a buildup of fluid or hernia. Then there's pain. That's another sign that can be related to other conditions like infection, injury, or twisting. If cancer is detected, treatment options and recommendations depend on several factors, including the type and stage of cancer, possible side effects, the patient's preferences, and overall health. The first treatment for testicular cancer is usually surgery to remove the testicle. Rarely, chemotherapy is given first if the cancer has already spread beyond the testicle when diagnosed. Testicular cancer is one of the most beatable cancers when detected early, nearly 99%. According to the Testicular Cancer Foundation, the best way for men to be proactive is to do a monthly self-exam of their testicles to check for lumps and hardness and swelling. It's recommended to do the exam in a shower since the steam relaxes the scrotum and makes it easier to feel around. At the beginning of this video, I mentioned that I'd give you a great resource, and here it is. The Testicular Cancer Foundation offers a shower card to remind men to do their monthly self-exam. It has steps on how to perform the self-exam, what to look for, and what to do if you feel something suspicious. I ordered one for my son. The card itself was free, and I only paid a small shipping charge. Check out the shower card for yourself or the man in your life. I'm linking to it in the video description. Let me know if this information and the resource has been helpful. I'll see you in the next video.